Let's talk about the menopause supplements that the internet swears by. Now, if you're a midlife woman on social media, I'm pretty sure you've been told to buy some type of menopause supplement: black cohosh, evening primrose oil, ashwagandha, turmeric blends, any hormone balancing gummies. You name it. Companies are racing to cash in on what investors now call the menopause economy. Yeah, this is big business. You hear me? The menopause economy is projected as roughly about a $600 billion global opportunity across medications, drugs, technology, and especially supplements. But I want to talk to you about something. There's something that your For You page usually isn't going to tell you about these products. Very few of them have high quality, randomized, placebo controlled data behind them. And some, they carry very real safety concerns. I'm Dr. Erica R. Jones, MD, and I'm starting a conversation with you about the menopause supplements. The first question is, do they actually work? So we're going to start with one. It's the star of the show. We learned about it in med school. It's called black cohosh. Now, there's some small randomized trials that have found that black cohosh can reduce the hot flash severity and frequency against placebo over about an 8-week time period in some postmenopausal women. Now, there are some head-to-head trials that suggest that black cohosh might improve hot flashes and menopause-specific quality of life more than evening primrose oil. But you can't just take those studies and say, yes, it's going to help everybody, because you have to really zoom out and get the larger picture, because the larger, more rigorous trials that have been funded by major agencies have found that black cohosh doesn't really perform better than placebo for vasomotor symptoms. And in one study, some women on black cohosh actually had more vasomotor symptoms like hot flashes at 3 months than those on a placebo. So these are all things that you got to look at. I'm not saying it doesn't work. I'm just saying that you have to look at the studies, and the studies conclude that black cohosh, they might help some women, but the results are really inconsistent and they're not strong enough to recommend it as a reliable standalone treatment for hot flashes. That's the important part of the conversation. So you have to really look at these different menopause botanicals. I mean, even think about the evening primrose oil. One trial found some benefit, but then another one, which was randomized and it used 2,000 milligrams a day, shows that there was no significant improvement over placebo for hot flashes and sweating. So you really have to make sure that you are just looking at the studies. Ask your doctor what the evidence shows. And remember that everything isn't going to help everybody. There is a small percentage of the population of women that might get some benefit from, certain supplements. But it's important that we don't just name these like hero ingredients. We can say that they might help a small subset of women. When you talk to your doctor, just ask them like, hey, what does the evidence show? What actually works the best? Some of the things that these advertisements and social media doesn't talk about is the safety risk of supplements. There are supplements that are marked as natural, but just because it's natural, it doesn't mean that it's safe. There are some case reports that are out there that talk about acute liver injury and even some fatal acute liver failure that are linked to some herbal menopause supplements that contain a lot of different ingredients, including like the turmeric, the moringa, and then a woman might have been using these for hot flashes and bloating. Black cohosh is also another herb that could possibly be toxic to your liver. It's not the only one. There's some other ones, but these could be potentially harmful. So it's important that you talk to your doctor about any supplements that you are taking, and they can weigh the benefits with you. They can weigh the risk with you. It is important that you look at these menopause supplements and what are in them. You know, some of the supplements are sold as dietary supplements, and a lot of times what that means is that they're not tested for safety, purity, or efficacy before they hit the market. So while most women may not experience severe harm, the risk isn't just zero. And you often don't have a way to actually know like what's in that hormone support blend that you're being sold. You have to be able to understand what the evidence shows, and your physician can help you with that. I'm going to tell you the unsexy truth. The most effective treatments for hot flashes and night sweats are still evidence-based hormone and non-hormonal therapies, not influencer stacks, not those influencer supplements that you're being sold. Menopausal hormone therapy with appropriate dosing and screening can significantly reduce hot flashes. We call those vasomotor symptoms, and it can improve quality of life for many women. You just have to weigh the risk and the benefits with your provider. There are also, outside of estrogen and progesterone, some non-hormonal prescription options. Just talk to your doctor about them. You know, they might talk to you about some of the SSRIs, the SNRIs, and other medications that have data that's showing meaningful reduction in hot flashes for women who cannot or do not want to take hormones. So just know that there are options to treat menopause symptoms. Be clear, communicate with your physician, and let them know what's bothering you. If you like this video, make sure that you share it with someone who needs it and hit that like button. If you haven't already subscribed to my channel, do that.